screening last week, and the parent was happy to leave the room, and they closed the door, but I know that it's still just not the same as in the clinic when I can ask a parent to go to the waiting room and talk to the child alone about what's going on. So what are we seeing? Okay, this is my Texas article. I had mixed it up in my order of slides. So some areas are seeing a rise in the severity of cases. So this was Newsweek at the beginning of April reported Texas hospital seeing child abuse cases rise in the COVID-19 outbreak. And so in general, with our practice, we do see a lot of kids outpatient. Those usually are the less severe cases. And then when we're called to the hospital, those are typically the more severe cases. So if you're seeing an increase in hospital consults or hospital outbreaks, that means that they're more severe. So even though we're not seeing as much abuse in general, the more severe ones are becoming more common. There was also a New York Times opinion editorial at the beginning of April by Nina Agrawal. She is a child abuse pediatrician on the East Coast that belongs to the same society that our child abuse pediatricians do. So we do hear her talk sometimes at our conferences. But she reported in her article that New York and the UK are also seeing an uptick in domestic violence. And we do know that domestic violence and child abuse can go hand in hand. Suicide hotline calls are up around the country. And then children are at higher risk of sexual abuse, as we mentioned earlier. In general, children will often confess to their mothers when there is abuse, which can be difficult at this time because they are may not be able to get away from a perpetrator. Perpetrators will often remain in the home because a perpetrator can be the primary breadwinner. And when families are at risk of losing jobs, it just makes some of the family members even more dependent on the one that has a job. So she does, Dr. Agrawal does recommend small acts of support that can help. Just listening to families, doing virtual check-ins. I'll have more on this later as well. On the right side of this was an article that showed a TV journalist who had written the domestic violence hotline number on the back of her hand and just had her hand up in view of the screen of the camera while she was talking. So it's not something that you can talk about as openly if you have victims and perpetrators together. There's always a concern that if a perpetrator knows that a victim is trying to seek help, that can increase the chances of violence. So this was a way that one journalist actually was trying to get the word out, so some of these people who might have problems can call in. So what can we tell parents? The American Academy of Pediatrics has developed some advice for parents who are experiencing stress. There are a lot of different websites that I'm going to show that will talk about similar things like this, so I'm not going to go into detail about what this one in particular talks about, but this is one that's easily Googleable. You can look up at the American Academy of Pediatrics. They have a lot of references. There's one that was put out by Child Trends that I thought was particularly helpful. So this is something that you can use to help parents understand what the kids need during this time, or how to promote children's resilience. Resilience is another big topic in our field as well. So they have it divided up into protective factors. I've just listed the protective factors here, but it's actually a really long brochure that gives a detailed description and examples of what to do for each piece. So protective factor 1, sensitive, responsive caregiving, which really can just mean listening. And when a child expresses a need, then you can let the child know that you've heard that need and will do what you can to help them. So meeting basic needs at this time would be another protective factor. So if a family isn't having to worry about how they're going to buy groceries, then they can be more sensitive and responsive to their children. Protective factor 3 would be emotional support for children, just talking to your children about their feelings. And there's another reference I have that discusses this as well. And then remember that the caregivers need support also during this time. And especially if they have a household full of small children, they're going to need some an adult to talk to or an adult to help them out. And social connectedness, which fortunately during this particular pandemic, we do have the internet, which we didn't in historical pandemics necessarily, so we can stay connected some way. It's not as ideal as in-person connectedness, but it is at least some connections. So a lot of people that we work with on multidisciplinary teams, one of the reasons I brought this next reference in is how can multidisciplinary teams help? So the Zero Abuse Project has 25 tips for MDTs on responding to child abuse during a pandemic. I'm not going to go through all of these, so I took a few out that I thought were more important, at least for our practice. It's important to educate all the adults that are mandated reporters about their role in protecting children during a pandemic. So if you see something, it's important to let them know they need to say something. They need to make that appropriate phone call, whether it's to Child Protective Services or law enforcement. In Oklahoma, all adults are mandated reporters, regardless of what their position is. So if you're seeing something that's happening with a neighbor, you need to make that phone call. If you're doing virtual therapy and a child discloses, you still need to make that phone call. And educating MDTs can help educate the public to be on lookout for signs of abuse. So looking at the family interaction, looking for injuries, or other parents abusing drugs, things like that. To know that they need to watch out for those children. As far as MDTs, it's important to make a list of at-risk children and develop a plan to check on them. At this time, marginalized groups of children are also at even higher risk, so develop resources for LGBT youth and other high-risk groups. We work also at our clinic with youth that are homeless, and so they're at high risk already, and then can need some more help during these times. Also recognize that children may find different ways to communicate abuse. So that, especially an 8-year-old that lives with a parent and doesn't have interaction with a lot of other adults may not be able to communicate that easily when their parents are around, but they may have ways, developmentally different ways to talk about it. So they may talk about being scared of a dragon or scared of something else, or that something happened to them, but they can't articulate exactly what it is. Older children, so young adolescents, once kids get on the internet, they may be disclosing abuse that way. So it's important if you have virtual contact with children to make sure that these children are safe as well. Continuing with safety checks is very important. So even though we can't go to every person's house at this time, making sure that you do have a way to check in with the children. Resisting initiatives that increase the risk of abuse. So keeping a child in an unsafe environment just because we don't have an abundance of foster families waiting is not necessarily the best thing for a child. They need to be safe, so resist things that will keep you from helping to protect children. Understand and enhance risk to online safety and what that would be, and especially for young adolescents, that can be a big issue. But children being contacted through internet resources or online resources, or having strangers or perpetrators meeting up with children and communicating online and then asking to meet out somewhere at some point. So with the children being at home and using the internet all the time, that can be increased risk. Also preparing for challenges facing rural communities. So there are often not as many resources there. And those kids can often be isolated in general, and now they're completely isolated. Continue to try to rely on your multidisciplinary team and CAC model. I know our CAC has been stressed because we don't have people necessarily working at our center, and our medical exams have actually gone off-site, which is increasing the stress for those who bring kids to us. But trying to, through this time, knowing it's temporary, that we can still work together as in a multidisciplinary team. Protecting yourself, so use appropriate PPE and follow your good hygiene practice. Wash your hands, try not to touch your face. And then of course, for all people who are in fields that are caring for other people, reach out for assistance. And this is a stressful time for all of us. I know that ER doctors talk a lot about things they see and are reacting in a way that's like PTSD. And I think that's not uncommon for people in helping professions. So make sure that if you need some help that you can also reach out for assistance. Our team for Children at Risk, which is the name that we have for our general team of child abuse and fostering hope clinics, has produced a couple of resources. The first one was primarily been for physicians, and it was through St. Francis. I'm happy to send PDFs of these out so people can have them if they'd like, but they're just, this is a one-page handout. April is National Child Abuse Prevention Month, and so that's why we put this handout in St. Francis's newsletter this month. So just has some basic strategies for prevention of abuse and neglect. One of our two fellows, which I didn't mention earlier, and I'm sorry to not mention them, but we do have two trainees with us. These are child abuse, or we call them baby child abuse pediatricians. They're child abuse pediatricians in training. Dr. Beeson has put together a flyer through OU Physicians that can just be handed out to families and give some resources that you can use during this time. So really, it's important to just remember the children. So when you contact people, whether it's in person or virtually, just ask them, how are you doing? Ask the parents, how are you doing? Ask the children, how are you doing? Sometimes people just need someone to be listening to them and a sympathetic ear. Remember, and I didn't talk about this as much in the child abuse portion, but younger children are at higher risk for abuse. I had mentioned that the youngest groups are the ones that can't reach out and get their own help. And so they're extremely isolated. So pay attention when you see young children. Keeping a list of mental health groups, social workers, and counselors who can do check-ins with high-risk families would be a good resource to have when you're talking to families. And of course, you can, if you do need someone to do a safety check, if you're really concerned about a child's safety, then you need to call the police and they can go out and check. Encouraging parents to talk to each other, and that's not just the parents in the same homes, but parent groups can be very supportive of each other. So parents of kids, especially of similar ages, online virtual groups with similar interests can help people get through situations and times like this. So conducting remote learning groups for children, parents doing this together can actually make it easier, because I can tell you the virtual education has been a little bumpy to start with, and I can't even imagine how it is with younger children, because my children are older and can do a lot of this, but the younger children must be particularly difficult. And then of course, remember that everyone is a mandated reporter. So if you see something, say something, make the appropriate referrals, and see if you can get help for that child, or help for the parent, or help for the family in general. And I believe I have a couple of pages of resources, which will be on the slides that will be available. And this is my last slide. So I'm happy to take questions now.
Okay, thank you, Sarah, very much. We have so many people here, 230 people. So we will not be, so we will not be able to hear them, but if you have questions, if you can please write them on the chat. And Christina, are you with us?
I am. I'm seeing on the chat right now, Sarah, that somebody is asking if you would be able to show the resource slide again, because they're interested in seeing it.
I had two resource slides. So the second one is a lot of links to the articles, but also links to the American Academy of Pediatrics. And then the first one has a couple of the academic articles I looked at. I have Dr. Beeson's and Conway's names because they did our two handouts for our team, but then also links to the rest of the online references.
Okay, so we have a question. Have you seen a change in the reports of child sexual abuse?
So we have not been seeing as many, at least in my practice. Now, out of the 3 child abuse pediatricians, I probably do the least amount of abuse work. But I know that Dr. Baxter was talking with me, and he'll be talking tomorrow. Last week, he was mentioning that just referrals in general were going down. So what usually happens, because with child sexual abuse, there's often a delay in disclosure. We're expecting in the fall or in the winter to start getting a lot more referrals for child sexual abuse. So once these children get into a different environment, feel safe, are in school, then they are more likely to make a disclosure. The average time of child sexual abuse to disclosure can be as long as 18 months to 2 years. And that's just because a lot of times kids need something to trigger or not trigger them to disclose. Maybe it's not the best way of saying it, but child sexual abuse is something that is generally pretty hidden anyway for multiple reasons. And I have a whole other lecture about that, but I hope that answered some of the question.
So the next one says, I have reported concerns about teens to DHS and find that they are often screened out because of their age. It appears that it is assumed that they are safer because they can speak up, but they don't.
And I've seen that often as well. It's something that's always bothered me. Once children reach an age that it's assumed they can protect themselves, but it's important to remember that young teens can be very persuadable. Teens can be very manipulatable. So they're at incredible high risk. Often I've made referrals about teenagers and they get screened out, and this is my specialty. So I don't have a solution for that since I don't work for DHS. But I think a lot of it has to do with lack of resources, and we can try to explain it in a lot of ways, but it's something that's always bothered me as well. What I tell families, or what I tell other medical providers, is that even though you know it may be screened out, you've got to do what's right for the child and just go ahead and make the referral. They do keep track of referrals that are screened out. So if something comes in the future, at least they can see if there's a pattern. But that's about one of the few things I can hang on to in a situation like that, because it sometimes keeps me awake at night as well.
Okay, so the next one says, Dr. Passmore, my question, is there more abuse going on now because kids are at home, or is there less abuse reported because the kids are not as much around mandated reporters?
I would say yes to both of those. So kids are at home alone in a high-risk situation. So more abuse is likely going on. We just don't see it because the mandated reporters aren't having eyes on the kids. That's correct.
Does anyone else have any more questions that they would like to put in the chat? Okay, you mentioned younger youth disclosing differently because their developmental expression is not as advanced. Can you explain that further?
Sure. So in pediatrics, we talk a lot about child development and language development and how children express things differently. Our forensic interviewers, I think, have done it, show a great example of this, that they are educated in the different ways that children may disclose. So for instance, if you have a child that's probably 6 to 8 year old, that fantasy is a big part of what they do. Fantasy is a big part of their play. They may disclose something happening in a fantasy land, but it's sort of mirroring something that's happening happening in real life. So looking at those concerns, but there is a big caveat with that, because children have fantasies and they play and they talk about their play. So anything concerning, or if they're talking about in their fantasy play, like something sexually inappropriate that you wouldn't expect a 6 or 7 year old to know, but they're putting that into their narrative, that's something to listen to raise your concern. When kids get to be older ages, they can talk more, but when you have teenagers, a lot of times they won't talk to adults or adults they don't know, so they may not be disclosing very easily. So establishing trust with the older kids. We could actually have a whole lecture on child development in the ways that kids may talk about things, but they're going to use different words. They're not going to say, hey, last night this happened and it made me really upset. So you've got to sometimes read between the lines with children.
Thank you for that, Dr. Passmore.
Sure.
We've got a couple more questions.
Okay.
What are some suggestions you may have for people working with the 0 to 3 population in screening for abuse through telehealth and particularly phone call sessions?
So that's a really hard one. So telehealth, at least when I do my telehealth visits, I ask to see the children. I haven't done telehealth, at least so far, on a young child, so I haven't had to ask clothes to be removed, but especially, I know a lot of doctors are even doing telehealth for things like rashes. So you're gonna have to be looking at the skin. You could theoretically ask a parent to undress the child and weigh the child and bring the child up to the camera. So that would be something that you can see. It's just not ideal, unfortunately. Phone call sessions, again, talking to parents about stresses. So when I've been talking to parents so far, like I had a telephone call this morning, how are the kids doing? How are you doing? So that might let you know if there's more stress in the home. And reaching out to that parent, because then maybe they'll seek help and that child will get seen. This is something that's worried all of us around here, that abuse is being missed because of telehealth and telephone calls that are happening. But those are a couple of things you can try.
Okay. Why are girls experiencing more sexual abuse than boys right now?
In general, girls experience more sexual abuse than boys. That doesn't mean boys aren't experiencing sexual abuse. I think right now the reason it's probably more for both boys and girls. It's just exponentially for girls, we see more sexual abuse in general. So, but yes, boys are at risk as well.
What are some basic messages we can put on social media that we can say to local media that will help protect children during this time?
So reminding people that they're mandated reporters, just really to look and listen would be one of the main things. So if you see a child, if you talk to a family, listen to how they're doing, look at the child, see if you see anything at the time. I believe not the last handout I talked about with the 25 recommendations, the one before that I think had some really good tags that would be appropriate for social media. But that's one reason I wanted to put links to all of those handouts, because they have some really easy to understand statements that can be used.
Why do you think we don't talk to adults and kids about not abusing as part of prevention programs?
Well, pediatricians should be talking to parents and kids. A lot of the hospitals do the period of purple crying, so that would be child abuse prevention or prevention of abusive head trauma. And pediatricians, part of anticipatory guidance is abuse prevention, because if you can talk about child development and help parents understand what to expect, that can be helpful. In general, adults, I don't know if I can necessarily comment outside of the physician circles, but as far as pediatricians and well checks, that should all be part of abuse prevention. I'm a big advocate for abuse prevention, but usually the issue that we see, and I know is a problem here in Oklahoma, is that there's not funding for child abuse prevention programs. And I wish there were more.
What actions are being taken during this time that workers cannot go out to the home who has children on their cases who have recently returned to parent reunification?
So I honestly can't talk about what actions DHS is taking, because I don't work for them. So I'm afraid I can't answer that one.
And this is the last one so far. Do you have ideas for parents, especially adoptive parents, who brought a foster or adoptive child into their home older than the other children in their home, for protecting their younger children from possible physical or sexual abuse by the older child?
That's a difficult question, because that question could be not just during a pandemic, but in general, if you're bringing an older child in the home, because if they've experienced something that can affect what they do to other children. So of course, being watchful, making sure the younger children in the home aren't alone with the older child. I'd like to think that, I mean, despite doing this for a job, I do believe that most people are not going to do bad things to other people, and that foster kids or older foster kids have just had a bad time. That they will all necessarily be abusing the younger children. So just making sure that especially during an adjustment period, that you are not leaving them alone with the older child.
Thank you, Dr. Passmore.
Sure.
Let me see. So for those of you who were asking about DHS, a couple of DHS workers have responded in the chat if you're interested in reading. And we have an additional question. If you could talk to a teacher, what would you outline are the most important things to look for while doing virtual learning?
Virtual learning is so difficult because especially, and I know that my kids have a lot of other kids in their classes, so it's hard for a teacher to be seeing each child individually. One thing paying attention to is if whatever platform you're using, like Zoom, has a chat function, telling kids that if they want to say something to the teacher that's private, they can say it in the chat function. Asking children how they're doing. You won't necessarily be able to see injuries unless they're facial, and usually only if they're significant because the cameras often aren't good enough. But I would say that especially for online, when you're talking about these class things, say, hey, if there's something about the classwork you want to talk about, if there's anything else you need or that you don't have, or if you want to, you can even say if you're not feeling safe, you can put it in the chat and then the teacher can refer it to the appropriate agencies like DHS or law enforcement.
What are your thoughts on how this situation will impact future policy on child maltreatment identification and prevention?
I'm hoping that in the next year, at least, it's going to increase the understanding and awareness of child maltreatment identification and prevention. In my years of practice, I've only seen budgets being cut in that area, so I've never experienced an increase or experienced, at least this state putting more into that area. I would hope that as the next year goes on, because right now, since we're not seeing cases, awareness is not being brought to this area. I'm hoping that it will bring more of an understanding and increase funding and increase programs that can help prevent and identify.
Thank you. Paula, Gal, there's no more questions as of right now. Do we have any more time to take more?
We do.
Yes, we have 10 more minutes and then you will say a few words about CEUs. I saw in the question that people ask when they can get the PowerPoint presentation. So we will send it to your emails. Don't worry, it might take a little bit time because we have 2 lectures per day and a lot of work, but you will get it, don't worry. Sarah, there is a question if they can share the PowerPoint.
I don't mind you sharing the PowerPoint as long as you give credit to our team for children at risk, because it was put together by myself and Drs. Conway and Baxter.
Okay, Christina, you can continue. But you are on mute.
Thank you, Gal. So we have, think about teachers in Oklahoma. They threatened strikes to get some funding. That was a note. And then we have, are you seeing or do you anticipate increased online exploitation or sexual abuse that is related to increased use of online platforms during this time of stay-at-home orders?
I've already seen one article referring to that. That was actually NPR last week that talked about online sexual abuse. And I don't know if they mean real time or online child pornography is really increasing right now. So I am expecting this to, in the next year, especially when kids start getting out to seeing the other adults, I think it will be increasing, or I think it is increasing and it's going to be disclosed more often.